Good morning to all. Today we are going to see about the condition is hydrocephalus. So let's start with the introduction. The name hydrocephalus is derived from the Greek word hydro, which means water, and cephalus, it's a head. So as the name implies, it's a condition. The primary characteristic is excessive accumulation of fluid in the brain. So hydrocephalus is the abnormal accumulation of cerebrospinal fluid in the intracranial spaces. So let's see about the what is cerebrospinal fluid? It is secreted in the choroid plexus, cerebral ventricle. So it is formed daily 150 ml and absorbed by the arachnoid villi. So next, it is normally found in 500 ml per day. The incidence of hydrocephalus without spinal bifida is approximately 1 in 2000 to 500 live birth, making it one of the most common developmental disabilities in children. In past 25 years, death rate associated with the hydrocephalus decreased from 54% to 5%, which means the highly efficient medical interventions in the society. Okay, so next we are going to see about the types of hydrocephalus. In first one is the communicating hydrocephalus and second one is the non-communicating hydrocephalus. And in that, communicating hydrocephalus is a condition that results when the arachnoid villi are unable to adequately reabsorb the CSF fluid and intraventricular or subarachnoid hemorrhage, any hemorrhage in the subarachnoid space, and infectious process such as the meningitis may also render to arachnoid villi to be the non-function. And next, non-communicating hydrocephalus. Non-communicating hydrocephalus is a condition that results when the ventricular system does not communicate with the arachnoid villi. Already we know that arachnoid villi is absorb the CSF fluid. Here there is a disrupt in the communication between the arachnoid villi. So here this pathway is obstruction that may cause the hydrocephalus. Etiology: congenital intrauterine infections, congenital brain tumors, intracranial hemorrhage, congenital malformation of the arachnoid villi. These are the causes may cause the hydrocephalus. And next, acquired type of hydrocephalus due to the inflammation, any trauma, neoplasms occupying the lesion like tuberculoma, subdural hematoma, or abscess or papilloma. And then clinical manifestation in infants: head grows at abnormal rate. And then here we can we have to assess with the check the head circumference of the children's. And then anterior frontal is tensed, often bulging and non-pulsative. Scalp vein is dilated when the infants cry. And then Mason sign is elicited that children is having hydrocephalus. And then frontal bossing with the depressed eyes, sunshine eyes, and feeds for the children. Those who are having the hydrocephalus, they are having the poor feeding, and pupils are sluggish and unequal response to the light, changes in the level of consciousness. These are the signs and symptoms we can see in the hydrocephalus. In childhood, headache and then awakening, papilledema, strabismus we can see. And diagnostic evaluation, we have to do the physical examination. When we are doing the physical examination, we can observe the Mason sign, which is the cracked pot sign. When we are percute the head, we can observe the cracked pot sign. And then positive transformation of the infant's head, and then ophthalmoscopy, MRI, CT scan, X-ray skull. These are the diagnostic evaluation we can done for the hydrocephalus. And next, move on the lumbar puncture also we have to do. And the next, medical management. First, our goal is reducing the intracranial pressure, prevention of management of complication, managing problem caused by the pathology, and then we have to reduce the osmotic pressure. And the surgical management. In surgical management, a shunt is made up of radioplastic and has ventricular catheter, pressure valve, pumping chambers, and distal catheter that directs the flow of the CSF fluid from the ventricles to the area of body. And other surgeries: endoscopic third ventriculostomy, choroid plexectomy, ventricular peritoneal shunt, ventricular pleural shunt, and then ventricular gallbladder shunt. These are the from ventricle to the they connected the shunt in the peritoneum and pleural and then gallbladder. And then an alternative procedure like endoscopic third ventriculostomy.